everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Allopurinol. Its brand name is Zyloprim. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So allopurinol and its metabolite oxypurinol decrease the production of uric acid by inhibiting the action of xanthine oxidase. This is the enzyme that converts xanthine to uric acid. In terms of indications for use, allopurinol is indicated to be used in the treatment of gout. It can be used in the treatment of recurrent calcium renal calculus, and it can also be used to treat patients who have increased uric acid levels, for example, in patients with cancer such as leukemia. Before somebody was to use allopurinol, there are some contraindications they must clear, as well as some precautions and warnings that they should be made aware of. It would be contraindicated if a patient is using didanosine, if a patient has a hypersensitivity to allopurinol and has had a severe reaction in the past, as well as a hypersensitivity to any other component of the product, they would not be able to use this medication. And carriers of the HLA-B5801 allele would not be able to use allopurinol due to the increase in potential for serious cutaneous skin reactions. Now, in terms of precautions, patients should be made aware that severe cutaneous and hypersensitivity reactions are a possibility with allopurinol. This would include exfoliative dermatitis, urticaria, purpuric lesions, Stevens-Johnson syndrome, drug reactions with eosinophilia and systemic symptoms, also known as DRESS, generalized vasculitis, and irreversible hepatotoxicity. There may be an increased risk of hypersensitivity reactions in patients who have decreased renal function who are using thiazides with allopurinol. Patients should be made aware that bone marrow suppression may occur with the use of allopurinol. Reversible clinical hepatotoxicity and asymptomatic rises of alkaline phosphatase and transaminases have been reported. An increase in acute gout attacks may happen with early use of allopurinol. This can happen even with normal or subnormal serum uric acid levels. Gradual titration over several months may be necessary to achieve control of these acute gout attacks. Increases in blood urea nitrogen may happen in patients who have pre-existing renal disease, as well as in patients who have poor urate clearance. If these renal function abnormalities persist, a decrease in dose or gradual discontinuation may be warranted. Adjustment of initial dose and close monitoring is recommended in patients who have decreased renal function. And patients should be told that renal failure has been seen with the use of allopurinol. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use allopurinol, they can expect to receive their dose orally through tablet form. If somebody is using allopurinol to treat their gout, they can start off with a dose of 100 milligrams once daily. The dose would then be increased by 100 milligrams weekly until a serum uric acid level of 6 milligrams per deciliter is achieved. Doses over 300 milligrams should be given in divided doses throughout the day. And the maximum dose would be 800 milligrams daily. If somebody is using allopurinol to treat their increase in uric acid levels, again, as we talked about earlier, this may be a patient with cancer, such as leukemia, they would use 6 or 800 milligrams daily for 2 to 3 days. They would do this paired with a high fluid intake. It's important to remember that doses over 300 milligrams daily should be divided up throughout the day, and that the maximum daily dose would be 800 milligrams. As with all medications, there are some side effects or adverse reactions that patients may experience while using allopurinol, so I'll go over some of those here now. In terms of dermatological side effects, some patients may experience a maculopapular eruption. And less than 1% of patients may experience itchiness of the skin. Some serious side effects would be a drug reaction with eosinophilia and systemic symptoms, or DRESS. Up to 3% may experience a rash. Stevens-Johnson syndrome is a possibility, as well as toxic epidermal necrolysis. This comes in at less than 1%. Granulocytosis and myelosuppression has been reported, as well as thrombocytopenia. Hepatotoxicity and renal failure may occur. Renal failure comes in less than 1%. Finally, hypersensitivity reactions are possible. That's all we're going to talk about today with allopurinol, or Zyloprim. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.